Your health and well-being may suffer greatly from excessive alcohol consumption. It's critical to be aware of the hazards and exercise moderation. The following are some explanations on why binge drinking may be detrimental: liver damage, cirrhosis, alcoholic hepatitis, and fatty liver are among the disorders that can result from excessive alcohol use. These disorders may even be fatal and have an impact on the liver's capacity to operate normally. Increased chance of chronic disorders. Excessive drinking has been linked to a higher chance of developing a number of chronic illnesses, including as pancreatitis, liver, breast, and colorectal cancer, as well as cardiovascular disorders. Impaired brain function. Because alcohol has an adverse effect on the central nervous system, it can cause memory loss, concentration issues, impaired brain function, and a decline in cognitive ability. Prolonged binge drinking may possibly cause permanent brain damage. Mental health concerns. Alcohol misuse is strongly associated with mental health issues such as anxiety disorders, depression, and a higher risk of suicide. While alcohol may reduce symptoms briefly, over time it can worsen underlying mental health issues. Social and behavioral consequences. Drinking too much alcohol can have a detrimental impact on conduct, as well as impaired judgment and decision-making. It raises the possibility of mishaps, wounds, aggression, and unsafe sexual conduct. Abuse of alcohol can cause interpersonal problems, social isolation, and poor performance at job or school. To encourage safe drinking and reduce any possible risks, take into account the following recommendations. Adhere to the suggested limits for moderate alcohol consumption. For women, this usually translates to a maximum of 1 drink per day and a maximum of 2 drinks per day. For men, know your limits. Recognize your personal alcohol tolerance and keep track of how much you're ingesting. Take it slow and steer clear of binge drinking, which is characterized by consuming a significant amount of alcohol in a brief amount of time. Take breaks. Set apart days during the week when you don't drink alcohol to allow your body to heal and lower your chance of becoming dependent. Seek support. You should think about getting assistance from medical specialists, support groups, or specialized treatment programs. If you are having trouble controlling your alcohol intake or believe you may have an alcohol-related issue, recall that everyone has a varied tolerance for alcohol and that situations might change from person to person. It's critical to put your health first and make wise decisions about how much alcohol you consume.